Well, that's a very, very good question. And with the huge impact of artificial intelligence in our everyday life, it's really reasonable to employ these models, these really efficient tools also in reading EEG. Now, what would be the benefit of the patients? I think first of all, those patients would benefit from it who are living in underserved area, in resource poor areas. Think of this. Most of the patients with epilepsy worldwide, 80% of them live in resource poor areas where there are absolutely no EEG experts. So using artificial intelligence, you could roll out this knowledge also to areas where patients do not benefit at all of EEG knowledge. Of course, there is a huge benefit also for the healthcare providers in those settings where experts are available. Typically, they are very, very busy and there is a huge work pressure on the experts in the centers. So an AI model which could pre-screen the recordings and show them, for example, during a long-term video EEG monitoring, which segments are totally normal. You don't need to you spend time on reviewing them. It would be a huge help also for the experts because it would make their work much more efficient than nowadays. Of course, there are huge risks with this if models which are not properly validated are put into the clinical practice, and there is a long list of potential bias, long list of explanations why some models work very nicely when they are published in papers, but then they do not work or they are unreliable when they are put into the clinical practice. So it's very, very important that the validation studies are robust to decrease the risk implied by using these models in the clinical practice.